then being a family, there is no issue. So the risk factors are that aligned for the sexual practices. Having multiple partners is a very big risk factor because one might be carrying and you just form a chain through that multiple partners. There are also issues of sores in the genital areas. When you have an infection, maybe there is some vidonda on your private part, that is a risk factor of you contracting HIV/AIDS. Exposure to blood and blood fluids, we have like the transmission, as I said, transplantation of organs, implantation of infected semen, which is something on the rise currently in the world. We also have the issue of using injectable drugs, especially for those people who share needles where they're injecting drugs. That's also a risk factor of these people contracting this virus. And of course, occupational exposure, like accidental exposure. I know, like the people who do casual work, they get into contact with a lot of this waste that we normally segregate. So most of them can get pricks of the needle, and it's a risk factor also, and even as for us as we work. Also, the issue of sexually transmitted diseases is another risk factor. So some of the symptoms that you can get, but they are not minimized to what I have just I will present. Like for example, you can have soaking night sweats, recurring fevers, chronic diarrhea, unusual lesions in your body, unexplained fatigue, unachoka tu na uelewi, mbona unachoka, kupoteza kilo, skin rashes, all those and many more that can come. Because once HIV gets into you, it gives you that, it exposes you to AIDS. And the AIDS now, that syndrome is which can bring about these issues of these symptoms and diseases. So there are ways of how we can prevent ourselves as healthcare workers at home, even the things that we can advise our friends how to prevent themselves from contracting. And remember, when preventing, you're preventing someone who is HIV negative from contracting the positivity of it. So some of the ways is, number one, you need to know your status. Without knowing your status, you won't be able to even handle the preventive measure, to know where you are. So behavior change and risk reduction, for example, if you see abstinence, be faithful, contraceptive, for the condom use, those are some of the ways you can prevent yourself from getting it. Also, we have the aspect of preventing mother-to-child transmission that we do handle, and we are majorly in this facility and in many other facilities like they do delivery of babies and handle ANC. This is a big pillar to us, that we prevent the child from getting transmitted the virus. So, and also, of course, preventing the young ones from also contracting the virus. We have the voluntary male circumcision. It's something that we all advocate for, that men, we know that uncircumcised skin is a big exposure to this virus. So we advocate for men to get circumcised. We have the aspect of safe cultural practices, so like avoiding the wife inheritance, those cultural aspects that can bring about contracting the virus. There is a way that us as healthcare workers, we can prevent that from happening. And also the female genital mutilation, which is a big campaign in our country, that this has to end, and it has to end. Also education, they always get informed about things to do with HIV. Empower the girl child. With that, I will also put a stroke of the boy child. If we empower each other, we are able to understand each other, and we are able to live a healthy life. There is the issue of post-exposure prophylaxis. Like in the health facility, we know that there are procedures that we follow in case you get pricked by a needle and you don't know what that needle is carrying. The aspect of you clean that area with soap and plenty of water. Then you seek the post-exposure prophylaxis services, which are offered majorly at our ART area. So in case of any prick, don't assume it. Just follow the ways that are set there. And I know that at the casualty there is an outline of how to follow until you get post-exposure prophylaxis. There is the big growing concern that we encourage people to uptake. This is the pre-exposure prophylaxis, where you prevent yourself earlier before you contract the virus or before you get exposed to the virus. when you consider yourself a risk group, there is always a way that you can prevent yourself. For example, let's say a surgeon who always goes to theater, they can be able to prevent themselves because they will get exposed to blood, and this person might be infected. It's a way they can take the drugs prior to that. And we have two areas on which men can benefit more. In one area called event-driven, where you only take when you know you are going into a risk. And then there is also the daily, which is also a good way of preventing yourself. So you can always visit us. We'll give you more information concerning the pre-exposure and the post-exposure prophylaxis.